Hi, my name is Eva Steiner, and this is my project Psychotherapists Around the Globe. I am interviewing the psychotherapists around the world and asking them the same 8 questions. I am wondering how mental health profession is in their country. Today we are going to. Thank you for taking this time for doing this interview with me. Before we start, can you tell me a little bit about yourself?
Thank you for having this time to get to know me and know my country. My name is Anud Al-Shubeli. You can say Al-Anud. And I'm a clinical psychologist, graduated from Princess Noura University in Riyadh, and then took my postgraduate certificate from King's College London. In general, I've been a therapist here in Riyadh for 3 years, and I know that I didn't gain a lot of experience. However, I've witnessed a lot of things that really influenced my approach in therapy. For now, I've been going more towards a holistic approach, which I find it very suitable to the culture I usually practice, which is the Saudi culture, because, holistic connects the body, the mind, and the spirituality. I'm originally an artist, honestly. And then I pursued psychology. So even in my holistic approach, I tried to engage in artistic views. I did several art therapy, or, I immersed art into therapy. So that's a bit about myself.
Let's go to the first question. Tell me a little bit about your culture. What is some holiday or tradition that your country celebrates? And if your culture would be an emotion, what emotion would it be?
So, in my perspective, I would say Saudi is a culture blend between forward looking and also Islamic views and the Bedouin culture. So, it blends all these three. And if you come here to Saudi Arabia, you would see the diversity, you would see still the old traditional views. However, it does not clash. You can see a lot of levels coming up together. Each region has its own cultural background. So if we say geographically, the south, east, west, and north, even the central areas have differences, even though they have common backgrounds. But the accents, the traditional clothing, even the traditional arts or dances, it's very different from each area. And it's very rich with a lot of artistic backgrounds. Like one of the things that they practice is known as Al-Arda, which is a sword dance that men perform. And that's been like in the culture for centuries. As for the celebrated festivals or holidays, most of the ones that we celebrate are Islamic based. So we have Eid al-Fitr and Eid al-Adha. They come in different months of the year. Eid al-Iftar is usually after Ramadan, and here we celebrate the end of the fasting month. So people gather, families gift each other, and there's traditional meals, and usually there's 2 parts into it. So mainly the morning part where they go to the mosque, pray, then gather and have breakfast, exchange gifts. Then there's another part that mainly a lot of people do, which is a midnight gathering, and they do celebrate, even dance to Saudi music. Then, as I said, the Eid al-Adha, it's something that's linked to Ibrahim's son being the sacrifice to God, and then the sheep came. So it has a Islamic background. So people usually give the needy in that month and spread again the joy of this Eid. So it's the Eid of Sacrifice, the Festival of Sacrifice. That's the English name of it. As for like traditional ones, I would say, other than the Islamic ones, I would say that there's something called the Girga'an. It happens mid-Ramadan. Not all areas celebrate it. Like some areas in Saudi Arabia think of this in a negative point of view, that it's a sin or you can't do that. And some areas do celebrate it. And it's not just restricted to Saudi Arabia, even the Gulf as a whole, especially Kuwait and Emirat, maybe they engage in this festival. So it's called Girga'an. Kids wear traditional clothing and they go door to door to take treats and, celebrate with their neighbors.
Why are some people opposing this festival?
Yeah, because it's a celebration with Ramadan. Ramadan is a holy month. They fast and engage in Islamic rituals. So having this celebration where there's music, there's dances, there's celebration, it kind of goes against it. So that's their point of view. As for the others, they think that it's part of the spirit of Ramadan, so why not celebrate this gift-giving festival. Yeah. So other than the Islamic ones, we can say that we have the National Saudi Day, where people celebrate their heritage. There's a lot of art programs or events that happens all around Saudi Arabia. Ministry of Culture has like a huge impact on that. They made a lot of advancements in making these traditions show more. Like people got to know about their backgrounds throughout engaging in shows that maybe musical shows that tell a story about our heritage, and even just as simple as people wearing their customs and talking about the attire that they're wearing, like it's from the south, it's from the north. Also, the newly added festival, which is called the Foundation Day, the Saudi Foundation Day. It's something that's linked to the first Saudi Arabia that has been established. So it was the first time that Saudi Arabia was found in Diriyah. As for the National Day, it's different. When the Saudi Arabia was established as a whole, like all the parts of it came together to establish the name of Saudi Arabia. So I think if Saudi Arabia was an emotion, it would be a complex emotion. I think it would be a deep sense of reverence, pride, and warmth. The connection, whether it's a spiritual or a heritage one, I would say that this warmth comes from this connectivity, familial connectivity, their connectivity to their roots, the Islamic perspective too. What I'm saying is that Saudi would be a landscape of emotion and mainly would be warmth to me, at least. Like I can sense the warmth and the familial connection. You know, they're really proud of being Saudi. We have a lot of diversity here, so I can see a lot of clients from all backgrounds, and I can sense this sense of pride and warmth in most Saudis when they speak about their country. You can see this connectivity they have with their roots. So yeah, reverence and warmth.
How did you become a psychotherapist in your country, and what is your therapeutic approach?
My journey started when I entered the medical foundation year. It was in Princess Noor University in Riyadh. It's called the Healthcare Foundation year. Afterwards, I started my journey in clinical psychology. For 4 years, I studied the major theory and practice. So we had frequent field visits for each class. So if the class was towards kids, we would go to clinics or even hospitals that have psychological aid for kids, and we would implement some tools as well as try these tools on ourselves. So like psychoanalysis and cognitive behavior therapy, we actively use these tools on each other and on ourselves. The curriculum was really enriching. It taught us a lot of things, and professors there were really passionate about psychology. Part of them were from Holland and part from Pakistan. So you saw the diversity. You know how Pakistani psychologists are different. Their background is more empathetic. However, you know, the Holland part, they're more practical and research oriented. So I like this mixture. Later on, I started my internship for 1 year. So the first 6 months I was in the National Guard Hospital. It was one of the most significant experiences in my point of view. So I saw a lot of cases, whether it was outpatient or inpatient. So we did frequent visits to the inpatient, like inpatient of heart diseases or kidney function. However, the other 6 months, what happens? The pandemic. So we were locked down, and mainly I explored the research area. So it was in Princess Noor University Hospital called King Abdullah Hospital. We did a lot of research and article reviews, so I feel like I did gain insight from both sides. Later on, I explored my choices educational-wise, and I enrolled in King's College London postgraduate program. I think it gave me a lot of insight of what I want to pursue education-wise and therapy-wise. In regards of the therapy that I pursue in the clinic. So for the past 3 years, I've been practicing in a private clinic in Saudi Arabia. My practice mainly is going towards holistic approach. And by holistic, I mean that I try to integrate many tools from different psychotherapies, such as cognitive behavior therapy. I like to start with it because Saudi's population that I dealt with, they like something scientific. They like something that they can see. So having cognitive behavioral therapy as a base is a very good start. And I've seen that they will grow into mindfulness approach, which is my main approach. So if I just start from mindfulness, they would say that you're just talking nonsense to me. So yeah, that's kind of my approach. And I do integrate acceptance and commitment therapy, depending on the case, honestly.
And in general, how do you become a psychotherapist in Saudi Arabia? Is there a distinction between psychologists and psychotherapists? And what about the law? Do you have law for psychology and psychotherapy?
Usually psychologists are therapists too. So if you have the license, you're licensed to be a psychologist and a therapist. Usually you have to finish, as I said, the year of internship. Afterwards, you will have a license of assistant psychologist. Then if you have a higher degree or practice for 2 years, you'll be a psychologist. Then you have to have master's degree and 2 years practice, so you become a senior psychologist. So currently I'm halfway through going to a senior psychologist, so I'm still a psychologist now.
So when you go to this practice, this year of practice, do you need a psychology bachelor or can it be something else and enter this practice?
It has to be a bachelor's degree. And even if you finish your master's, you have to have practiced an internship of 6 months or 1 year. So after each educational level, you have to practice an internship. And even afterwards, the assistant psychologists usually are a help of a main psychologist or senior psychologist. So they are supervised. Even if they do a solo work, they are supervised. Or you can say heavily supervised. As for the psychologists, we do a weekly gathering. We discuss cases so we can help each other. The community here, the psychologist community, is very helpful. You know, I told you last time that there's differences in the psychological background. So some psychologists don't like the cooperation of psychiatrists, and some psychiatrists don't like the interference of psychologists. However, I come from the background or the group, you could say that, think that we work hand on hand. But I think it's healthy for the growth of this field. Like the presence of a conflict doesn't mean that it's a struggle. It's mostly like people are exploring their beliefs or the things that they want to pursue, their point of views. I think it's healthy.
And is there law for psychology?
Yeah, there is a structure, and the Ministry of Health, especially the Saudi Commission for Health Specialties, is the one responsible for the certification or if anything goes wrong. And there is like strict ethical rules, and for hospitals, there's a committee that does the legal things. So for instance, if someone have a personality disorder diagnosis without having the MMPI test, that would be a conflict because you can't diagnose if you don't have this test. So the person would be held accountable, and they would have several meetings with this person to discuss what happened. It's more into the law, like they would have the law people to discuss if the person would have a sentence or like they would be held their license. So there are consequences to these things. And I think they are pretty harsh about this, which is kind of good because, as I said, the overall existence of qualified psychologists is very low. There are qualified psychologists, but they are very few. So I think having these strict rules would make the person feel that that's not something they could play with. Like they would have this sense of responsibility.
So the way I am understanding you, there is no distinction between psychology and psychotherapy for now.
Yeah, there's a distinction between the psychology sections, like there's the educational psychology, there's the clinical psychology, the general psychology. So general and educational psychology, they don't hold the license. Only clinical psychologists could have the therapy license. Let's say a school psychologist or educational psychologist would be licensed to practice in schools as a teacher or even a counselor there. However, they can't be in a clinical or hospital setting. And the general psychologist can't really practice unless they continue their specialty.
How society looks upon psychotherapy or any psychological?
So there's 2 points of views. There's the traditional one, which has a stigma to it. So Saudis used to see that the presence of any psychological issue is failure or issues within the family. and they have to solve it family-wise, or that there is something religiously that has to be healed through Islamic approaches. That's the historical one. It's still present, and I think stigma is present worldwide. However, the new wave of modernized, encouraging the psychological interventions, we could see them especially in the new generation. And a huge part of it is because the government had a lot of initiatives, especially after launching 2030 Vision, which stated that one of their goals is to have psychological aid in the primary clinics, and it should be more accessible to all people. Because, a lot of clinics here are VIP or in the hospital. There's not much accessible for people like in primary care. So there's a lot of events, campaigns, initiatives that happened, and I can see that even older generations are gaining insight about how they can deal with these psychological issues. Because, here it's a family orientation. If a person comes, even if they are very independent, they still have connections or even a partial dependency on their family. There's still this interference. It's because, Saudi Arabia in general is a collective community. So this codependency, it's still there. So when a person comes and discusses these things, we would ask them if they would like their family to join us later. So we do provide educational sessions for the family so they can understand the patient more, and it will lessen the stigma, especially for that person, at least around his family. They would know how to deal with the disorder, they would understand the disorder, and they wouldn't have harsh labels on this person. So in general, I feel like the new modern wave had a lot of impact on people. And I feel like the response of people in Saudi Arabia is very positive. Even the negative ones are not that negative. They would just reflect it on Islamic practices, which is not wrong, but they have their time to learn that some disorders are not a punishment from God or a distance from God. They would more understand that it originated from organic things or even environmental stressors. And even Saudi leaders, whether they are from the Islamic point of view, leaders that would talk about sheikh, that's what we call them, or even general leaders in the government, they talk about mental health and wellness. And this had, I think, the major impact because people can see that one of their idols or the people that they look up to talking about these things and encouraging wellness and psychological care.
What is your society teaching about child-parent relationship, and whether this value of society also influence how you design your interventions as a therapist?
I feel like Saudi society has a permanent traditional view about child and parent relationship. So we have values, we could say respect and obedience. So it is expected from the child to obey and respect their parents and elders. Even if there's family conflicts, you still have to be more flexible about it and, link to your siblings or even extended families. It is something that is expected. So the sense of unity. And also the interdependency, as the person would, even if they have little to no contact with their family, they still have their roots into their family. So for an example, if people get to know each other and they say their surname, they would link it to that family and they would know parts of this family. That's how they are connected. Even if they're not part of the family, they would know this person from their family and they would understand the unity. So even if they are distant from their parents or their siblings, there is something that's still connecting them to each other. And I feel like the influence on therapeutic intervention would be that there's family involvement overall. So even if the person is 18 plus, there is still family involvement. And it's very tricky for a therapist to maintain the confidential part and the family involvement. So what we usually do is that we discuss the points that we will discuss with the family, with the patient. We can reassure them that we're not going to say something extra. And we could reassure the family that the person is having this, and we're working on this. Although some people wouldn't like their family to interfere. we would get calls from the family asking for the information. So there's a lot of effort into maintaining this confidentiality. It's not that easy. And that's why I think one of the main things that we get to know at the beginning of therapy is how they are related to their family and how close they want the family to know about their situation. So we don't get into building trust itself takes time. So we don't want to scratch it from the beginning.
And what would you do, or how would you approach if the adult client would come to you and say, I don't want to contact with my family anymore, I want to cut it? How would you approach as a psychologist, and how would the culture look upon such a request?
In my point of view, like in my own approach subjectively, I wouldn't really interfere with this much. So I would respect that this person doesn't want their information to be told to their family, which is their right. So I would maintain this confidential part. However, how they're going to cut their family or not. So if it's something that's social, I would refer to a social worker. So if there's abuse or anything, I would refer to a social worker. However, if it's something that's not abusive or contained, they just don't want contact, I would honestly look into the issues that we could deal with. So if they have self-esteem issues, if they have setting boundaries issues, I think this would set a tone with everyone, not just their family. So I would pick on the things that would help the patient, whether they want to distance themselves from a toxic family member or toxic friendship. There's the culture sensitivity. So in Saudi Arabia, you can see different levels of people. So there are the westernized people that, maybe lived part of their lives abroad, and they come with certain beliefs. I think they might struggle the most because they don't belong to any part of this culture, not the family-oriented one, not the very independent one. We do pick on these points because if the person is more into family orientation or even very religious, we would consider this because, that's one tool that as a psychologist I would use in therapy. Like, okay, they are religious, they like their family, we could use this into therapy techniques. As for the more independent one, we would see if they have other support systems, maybe friends, maybe they're currently in, not maybe their family. Usually I would scan for the support system. And being culturally this sensitive is very difficult for all psychologists, especially that Saudi Arabia, as I told you, is very, very versatile. So you would see different backgrounds, different cultural approaches. So I do have a point to keep in mind always. So I know how to approach this person. So if the person is not religious, I wouldn't really approach them this way, because some of the complaints that comes in therapy is that the person wouldn't want to hear anything religious. And later on, like when we cut a whole sessions with this patient, I do address this again because they don't want to hear like go back to God and pray, because the person is struggling with cognitive distortions. So you can't really talk to this person from a level of acceptance. Going to God is more spiritual or more religious, so you have to have this flexibility in thinking. However, you're not at this level, so it will be triggering. It will be something that would make the person angry. So, and that's one of the things that I enjoy doing with my patients. Like, I know you're not anti-Islam, but I know that this thing really made you struggle because you did not see it from this light, because you were having really difficult times with your own thoughts. And honestly, I'm not that person that usually goes deeply into the religious talk. I'm more flexible. So if the patient would benefit from this area of, because all we do is like thought reconstruction or like trying to build a new belief into this person. So if this route would help this patient, I would take it. If it wouldn't, I wouldn't. It's not like I have this approach, I'm just going to do this. No, I'd like to be flexible with them.
What are the learned beliefs regarding client-therapist relationship, and can the relationship continue outside the therapy once the therapy process is over?
People do view psychologists here as authority. So they expect them to take care of patient and be respectful and honest, wouldn't like break the confidential part of this therapy. They look up to them and they do respect them, and they expect this person to be qualified enough to be in this position. So they have a lot of faith in this, and I think it does put a lot of trust into this person, especially that we discussed the confidentiality part. It's sensitive here because people know each other. Even if they're not from the same family, they know each other. So it's more difficult for people to come into clinics because they know they are risking getting known and being stigmatized. And also they put a lot of faith into this psychologist. They do think that we should or expect us to have culture sensitivity. So a person would come from a different background and they would expect us to understand them. So for instance, I'm from the central part of Saudi Arabia. If someone comes from the southern part, they would expect me to understand their cultural background because it's very different from the central one. And even in their talk, they would say that, in this part, we do this, or in this family, we have this role. Because part of our teaching is to understand that this clan or this family have this tradition, have this rules, because it's important. So a person from this family would come. We do have a small or brief background about this family, which is kind of, intense if you think about it. We try to know as much as we can. And, there's the educational role too. So they expect the psychologist to teach them and their families about this disorder or even about the therapy itself. Some of the things that I get from patients that were severally referred from several psychologists is that they don't even understand the disorder itself. So even if it's something physical, like some of the patients come from doctors as simple as, diabetes, they wouldn't really understand it. So what we do is that we take this physical illness and we discuss the implications that it has on the psychological issue. So education is very, very important and is expected. So several times that people would complain is that we don't understand even what we're going through. So breaking it up to them is very helpful. And I think it is something expected from us, honestly. And as I said, my approach is more holistic. I do like to integrate the traditional practice with the cultural background. So as I said, I like to integrate mindfulness. I would like to start with CBT, then integrate mindfulness. And mindfulness itself have the cultural background, like I could use it in prayers. They could be mindful prayers. We have 5 prayers as Muslims. The breathing exercises, usually I like to link it even with the prayers. So because they are 5 and across all the day, it's very nice if we associate it with a breathing exercise. And it is expected from us to be professional and ethical. Psychologists are always on the radar. Like if they make the smallest mistake, okay, yeah, you're not a doctor. So they have this aspect. So it is very expected from us to be a professional therapist because we are on the radar. Like they are picking signs more than other doctors. I would say the first 3 sessions, the patient is assessing you if you're the suitable one, and they're assessing from a scientific approach. Although, but most therapy is like a chemistry between the client and the therapist. So it's a very interesting thing that I noticed, especially people who have managerial positions. They always look into having this perfect, ethical, professional person.
Once the therapy is over, can you become a friend with the client? Can you have romantic relationship? What are the rules?
During and after the process, there's also, other than the ethical guidelines, there's the Islamic guidelines. So it is expected from us, even from the Ministry of Health, that the boundaries you have with the opposite sex, the things that you would follow to not fall into haram or the sinful thing, which could be as simple as having an interest with someone. Other than the ethical part, which is we can't really have extended relationships with this person. However, in clinical view, if I have an elder person and they are very friendly, I would approach them in that friendly way, but putting in mind the boundaries I have as a therapist. So I wouldn't really be rigid. I would be flexible, however professional. As for after therapy, we are prohibited from actually having any relationship or friendship with clients. However, if we do meet, like for instance, anywhere, if they approach us, hello, yeah, we'd have this small conversation or friendly conversation, but it wouldn't be more than that because, the community here is very friendly. They have this sense of unity. So we wouldn't really push them away. However, we would maintain this boundary. And if they approach us elsewhere, we would have a kind response. However, still maintain this boundary. Like we can't be more than this. Because even afterwards, after therapy finishes, there is a huge impact that the person has this image of this therapist that they went through on this journey. So if this image shatters or have any kind of bad spots on it, it would impact the therapy journey that has already happened.
Okay, the sixth question is supervision a must for a therapist in your country?
Yes, it is a very important thing. And as I said, the Ministry of Health and even the Saudi Commission for Health Specialties, they take hold for this position. They are the body that see any errors that happens and they give the licenses to the therapist. So there are requirements and they are rigid about it, honestly. And I told you because they want good quality therapists. So they wouldn't really be easy upon it because, as I said, therapists are from a new generation. They're not that much advanced in the field. However, they are given a lot of space. I said, like gaining a psychologist license is easier than gaining it in the UK or the US because I think we're still establishing this baseline of having practitioners. And I think we're getting there because I think this year they did, I'm not sure, but they do get more difficult to gain the next level license. So I think we are getting there. We are establishing this space. So they're putting more points into what you should have as a qualified therapist.
It sounds like the field is growing and also the rules are growing with the field.
Exactly. It is very expected from us to continue our professional development. So there are hours and there are supervisors that do view these continuous educational hours that we gain because they would expect us to be up to date about therapies and psychological interventions. It is very important in the profession to be supervised because it's a sensitive topic. It's very liquid. It's not something that we would touch upon with CBC blood tests or anything. It's very sensitive. And sometimes in private clinics, they wouldn't let the person practice upon just the first day. They would still have like 3 months. Even if the person is a psychologist, they would have 3 months with a senior psychologist observing this employee in a session, and then they would have this approval or not. So this is a very important aspect because they wouldn't like to have this person that would know theory but wouldn't really excel in practice, which is a lot of people do that because not a lot have practiced. Like Princess Noura University allowed us to go on field trips during our theory practice. It's not something that exists in other universities, and we did have this practice early on. It was enriched throughout the internship. If we had specialty studies, then again with another internship. It's very structured. That's why if you gain any theory background, you still have to do an internship because they don't trust if you can apply these theory into practice. And I think that's something worldwide, and we're just getting there. We're just starting to establish this knowledge that not everything with degrees or researches would be a good candidate as a therapist. Like a psychologist wouldn't be a therapist. Not all psychologists are therapists.
What are the most common complaints that the client comes to therapy for?
I would say that there's variety of reasons, one of which is common, the anxiety disorder. The person would have a lot of pressure from, they would have social, familial, work, or even friendship. So there's a lot of stressors. And I think managing these stressors could be something complex for people, especially if they are expected to handle it better and not complain about it. So there's work-related stress, and that's something I do honestly see a lot, especially in managerial levels, like anything management. They really struggle with stress because, again, they are dealing in the work as connection point between several people. And I've noticed also academic stress, especially in fields or majors that have a lot of competitiveness and the environment. In my perspective, it's sometimes the base of most of the issues that they come for. So sometimes they come for depression, but if we see it originally, it's something that stemmed from anxiety, chronic anxiety. I would say second would be depression, and especially that you would say the isolation and loneliness, because we have a society that is connected. However, being lonely or isolated is very common, especially if the person doesn't feel heard, seen, or even in tone with these people. So sometimes we see even the generational differences, or like I told you, the people that lived part of their lives abroad. When they come here, it's difficult for them because they're not like their family and they're not like the people they saw abroad. They're just different. And this could have a huge barrier for them in pursuing life, and it could manifest in depressive symptoms. And I think in general, life transitions, adjustment issues is seen a lot in currently married people or in grief or people coming from abroad to here, which is something very common. And another common thing is the family and relationship issues, especially if the relationship something that they have away from the marital point of view. They're just getting to know each other. So it's very sensitive for them. They can't talk about this with anyone. They just have this therapist that would guide them into how to navigate this relationship. And also marital problems, because, Islamically, men are allowed to marry 4 wives. And this is something that we can see wives struggle with. And also parent-child conflicts, because, traditionally we have this obedience and authority point of view for children. However, kids influenced by Western media, they get the other point of view. So, there's this conflict. Like, we grew up traditionally in obedient kind of point of view, and then this child comes with this other point of view. We do see these clashes a lot. And there's the cultural and identity issue, as I said. Even people that did not go abroad, as simple as just viewing social media or any Western media, it does get into them and they struggle to identify themselves. They would like something, they wouldn't understand if they like this thing, they go back to their tradition. So what we do is that this cognitive dissonance, we try to listen it up. You can't just pick one, you can't just pick whatever you are. You don't have to belong to any group, you can just belong to yourself, and then we enhance the good qualities of this person. Addiction and substance abuse, although it's very strict here, however, we do see people engaging in these things, even if it's not with substance abuse, technology or the media abuse or the behavioral addictions that happens. It's very, very common, especially in ADHD people. Also, there's the gender-specific issues. So we know that men would struggle with certain type of things, especially in being vulnerable, and females would struggle with being repressed, especially women that were born in the 80s or early 90s. We would still see this pattern because, the newer generation are less oppressed or challenged with the males. Also, the changes past 4 years, since there's a lot of change and they enabled a lot of women, there's a huge shift between the newer generation and the older generation. The cultural shock is showing up and people have this inner conflict, like, I could have had this option. There's also, chronic health issues. I feel like there's a lot of people diagnosed with diabetes or even fibromyalgia here in Saudi Arabia. A lot of them seek psychological help. Even if they're resistant, they know that they need the psychological help. So a lot of patients, they would be not interested in doing the work. However, they do come to sessions, and them just coming to the session means a lot, because it means that even if they don't have this ability to actively fix or, practice the tools I give them, they still are hoping for change. I think that's it. Okay, there's maybe social and peer pressure. Because again, we're very social people here and the unity is very important. And I realize that there's a lot of people pleasing. And I think, again, it stems from the desire to be part of this community or just to fit in. Their worst nightmare would be that they are not fitting anywhere.
The last question, if you would share one tool, belief, or approach that is a must-have for you as a therapist, what would that be?
I would say as a holistic psychotherapist is the mindfulness practice, because the mindfulness practice techniques itself is very similar to a lot of things that Muslims do. The mindful breathing, the body awareness, the here and now principle is very essential. So as we see that a lot of people here in Saudi Arabia, they see themselves as secondary. So they would think what people think of us or what am I going to do? They don't think of what do I need? How can I approach this? What's happening now? So they're always in their head. And that's something a lot of psychologists realized. So I think mindfulness is the tool for me because it promotes self-awareness. They understand their body, their needs, and even the sensation of, back pain or using progressive muscle relaxation technique is very important to me. Also, enhancing the management of the stress. So mindfulness does enhance how you can manage your emotions, how you can connect to your body. It's a very good fit to a lot of Saudis. As myself, I've been practicing mindfulness for 5 years now. The first year was really not that interesting. However, I just made it part of my routine and I've seen the results myself. And I don't just take it as what it is. I do integrate it to the culture here. So as I told you, I would integrate it into be mindful of the prayers that you do, how you practice, something we call khushu', which is being calm within this prayer. So it's very, very interesting how we do link these things together. And it is culturally relevant. Like one of my patients did ask me a very interesting question. He said that, how did you study all of that and then come again and say something that we normally do say in this culture, but within a really psychological insight? I can see how he just simply is very happy that we do engage with the culture. We don't just bring knowledge or deal with them as the West would do. We are here for the people. We do this as it suits them.